If layer 1 is not enough to relieve anxiety and depression, try adding layer 2. I can tell you, I have personally tried every layer 2 form of guidance listed here and more. This includes having had 3 years of personal analysis, on the couch 5 days a week, except of course for August. The one I found most helpful was experiential psychodrama. In fact, that kind of group therapy, I became so evangelistic about it, I led 2 psychodrama groups for 15 years. Loved it. You can mix and match any of these ways of guiding healing, and I do recommend that people try more than one. Psychotherapy effects last longer than medication effects. If psychotherapy is enough for depression, that's what you should do, not medication. This is from a study. People were given one form or the other of treatment for 4 months. They were given medication or they were given psychotherapy. It was all done after 4 months, but they went back a year later and found out that 76% of people who took medication had relapsed, could become depressed again, and only 31% of the people with psychotherapy had that effect. This is why people should not rush into a medication and exclude psychotherapy. Here's some examples of spiritual guidance. Spiritual guidance is about putting yourself in a state of mind to accept a state of grace. It may be the most powerful way to directly link with healing. Just about any spiritual program will do. One of my heroes, given my background, was Chief Red Jacket of the Seneca. He was given a Peace Medal by George Washington in 1792. So this is what he said to a bunch of Boston missionaries who came to convert him to Christianity. "Brother, we do not wish to destroy your religion or take it from you. We only wish to enjoy our own." Any religion will do, as long as it's spiritually oriented. I would recommend a kind religion. Shamanic healing, an example of shamanic healing 101 is forest bathing. It actually has a different name in Japan. It's called Shinrin-yoku. That means going into a natural space and soaking it in. The Lancet journal in February 2016 did a survey of a lot of studies of shamanic healing. They came up with 2 conclusions. One is the largest mental health workforce on the planet are shamanic healers. And the second conclusion was that shamanic healing is very helpful for mild to moderate depression and anxiety, not severe. I do not have the ability to do shamanic healing. Having spent time with someone who was doing it, he kind of chuckled about that and said, "Yeah, stick around for a couple more decades, maybe you'll catch on." It's not easy. Your brain will change if you follow a spiritual program, according to Lisa Miller in the American Journal of Psychiatry. She took a bunch of people who were predisposed to depression because they had a strong family history, and after 10 years she discovered that those who had a strong spiritual program had thickening of the left medial hemisphere of their brain. They also had a 90% reduction in risk for depression. The people who did not follow a spiritual program and became depressed had thinning of that same left medial hemisphere.